Well, let's talk about testosterone cardiovascular health. There's a black box warning in testosterone injections and in androgel. The FDA had drug companies put that in there because testosterone causes heart attacks, right? So tell us about that. What are your thoughts about that? And I have a very strong opinion about it, but I'll let you go first.
Mm-hmm. Yeah, the overall effect of testosterone on our cardiovascular health is positive, right? It's like if we go through each individual thing, there's some areas that are a little, they say with the lipids, in some cases you see the lipids go up, in some cases you see the lipids go down. But overall, like the effects that testosterone has on our cardiovascular health is very positive, right? You're burning fat, you're lowering your body mass index, you're reducing blood sugar, you're reducing your overall. What I typically see is a cholesterol profile will improve, and that's a whole other rabbit hole. I won't go down right now.
Exactly. We just
rabbit
talked
hole,
about that. Yeah, we just talked about that last week with Dr. Malcolm Kendrick. It was a very interesting thing about cholesterol and cardiovascular disease. And you're right. We could talk about that for a long time.
Yeah, but the important takeaway is we don't really care about cholesterol as much as we thought, right? We care about the markers that are actually going to have a long-term impact on lowering your risk for cardiovascular disease. And those big ones is like inflammation, blood sugar, waist circumference. Those are the big ones. And with testosterone, you see those things improve, right? It's anti-inflammatory, brings down inflammation. It helps to build muscle, boost up the metabolism. It brings down your blood sugars. Assuming you're you're not just eating crap and doing all that other stuff. You got to be like I said, eating healthy and exercising. But it's very synergistic, and the overall effect on the cardiovascular health is very positive.
Well, one of the things that I say when when that study came out about, I don't know, maybe 10 years ago about testosterone causing heart attacks in older men, I mean, it makes no sense. And this is the analogy I use. If high testosterone caused heart attacks or higher testosterone, then that means 19-year-old men would be dying from heart attacks. And they don't, because that's when their testosterone's the highest. So association does not prove causation. That's one thing you can take away from that study.
Yeah. And I think, one thing that is important, and I do tell all of my patients, is when you're taking testosterone, especially injections, it will cause your blood to get thicker. So the blood will get thicker. And when that hemoglobin goes up, then there could be an increased risk for having clots and strokes. So I always tell my guys, if you're going to be taking testosterone, you got to keep that hemoglobin within the healthy range just to eliminate that risk. And maybe having thicker blood isn't, I'm not 100% sure how. They say 50% of people who've had strokes have thicker blood, but that doesn't necessarily mean that everyone who has thick blood is having strokes. But if you take thick blood and you add on top of that inflammation, then that's really, a red flag. So it's keeping that inflammation down and making sure that the blood's not getting too thick. And in terms of cardiovascular health, that's the one thing that I do always try to stay on top of and make sure that guys are aware of that risk. Yeah.
Well, and we had an entire podcast dedicated to testosterone and cardiovascular risk from Dr. Neil Rosier, about a year ago, actually. And he talked about the increased hematocrit and hemoglobin and the risk. And he used some good analogies too. So if anybody wants more information on that, please refer back to that or message us on any of our social media platforms, and we'll share that with you. Because, I think what you said, Dr. Escobedo, is the most correct, is that it's not just the thick blood, it's inflammation. Because, people that live at altitude, if you live at 10,000 feet, which if you live in Breckenridge, Colorado, your body's going to compensate and you're going to have a high hematocrit so you can carry more oxygen.
Yeah.
But that doesn't mean you're at risk for a heart attack just because of that.
Yeah.
Or if you're a COPDer, and because you don't, your lungs don't work really well, your body compensates by carrying more oxygen with more iron. So you have a higher hematocrit. Same thing. They don't necessarily, because of that, have a high increased risk of cardiovascular accidents. So